Hello, I'm Jeff Riddle with the Natural Health Advisor Institute. Thank you for watching and thank you for caring about having good health. We're here again in Dallas, Texas at Holistic Wellness with Dr. Kate Namas. So Dr. Namas, thanks again so much for doing this interview. Last time we spoke about polycystic ovary syndrome, PCOS, and you can find that video in the description below this one. But today we're going to talk about another very common female problem, which is endometriosis. So like a lot of your clients probably do, I try to do some research about this on my own before I came in, and there's just not a lot of information out there. So even in the conventional medicine realm, even they don't have a very precise definition of what causes it and what it is. So in your experience, what is endometriosis exactly, and what are its complications?
So endometriosis basically is where the endometrial lining, which is usually on the inside of the uterus, is found outside of its normal location. And it can cause severe, painful menstrual cycles, pain with intercourse, pelvic pain throughout the cycle, and also lead to infertility.
Okay, so is it something to be afraid of if you think you have it or if you're diagnosed with it?
I wouldn't say it's something to be afraid of, but I would say it's something to be proactive about, since most women don't want to have to deal with severe pain half of every menstrual cycle, and most women do hope to have children at some point in their reproductive life.
Okay, and can it get worse later on if it's not dealt with?
It can, and then at menopause it will go away since it is a hormonal dependent diagnosis.
Okay, so when a woman first comes to see you, she hasn't been to a doctor yet, she doesn't know what's wrong with her. What are some signs, some short-term things that make you think she might have endometriosis?
So pretty straightforward, painful menstrual cycles, and not a little bit of pain prior to menses, but severe pain, and also pain with intercourse, pelvic pain throughout the month. And then also it is associated with women that are taller and thinner and have a lower BMI. So I'm also thinking about that when a woman comes in and tells me that she's having painful menstrual cycles or pain with intercourse or pelvic pain all month long, or that she's struggling with infertility as well.
Okay. How often do you experience that?
I would say that I see a woman with endometriosis every shift.
Like every day?
Yes.
Wow.
Right. Since my practice is entirely women's health in the reproductive years, it's going to be a common problem that I see.
Okay. So those are some of the more immediate symptoms. What are the long-term complications that can occur if no action is taken?
Subfertility or infertility is a big one. And then also there is an association with a certain type of ovarian cancer.
Okay, but endometriosis itself is not a cancer.
Correct, not a cancer.
So there's pretty much no consensus on what exactly causes endometriosis, but like a lot of other health conditions lately, it's becoming more prevalent over time. So usually that tells me there's something about the people's environment or about their behavior that's causing it rather than something, that's just systemic. So is there anything that you've noticed with people, that people have in common that come to you with endometriosis, that they're doing with their lifestyle or anything like that?
Well, what the literature shows us is that women who have less children, women who wait longer to have their first child, women who don't nurse as much over their lifespan or lactate as much, and women who start their first period, menarche, early and go through menopause late are more likely to have endometriosis, whereas women who have more children, breastfeed longer, start their period later in life, as in 14 years or later, and start menopause earlier are less likely to have endometriosis.
Okay.
And then we do see some association with increased caffeine intake, especially coffee, and increased alcohol intake, as well as other dietary associations like increased red meat intake.
Okay, that seems pretty common of a lot of people.
Right. Very common.
Now, a lot of women are probably aware of how important, especially female hormones are, and how important it is to be, to keep track of those and to keep them balanced. Do hormones have a role in endometriosis?
Yes, endometriosis is an estrogen-dependent disorder, and so when you're looking at medical treatment, oftentimes they're using oral contraceptives or progestins to mitigate the symptoms. So yes, it's very much an estrogen-dependent disorder.
Okay, I've heard that really commonly, that the typical prescription is over-the-counter contraceptives, the pills.
Mm-hmm.
So what's your opinion on that exactly?
Well, in my clientele, since my clientele is mostly women who are wanting to get pregnant and conceive and are struggling with infertility, the pill is not a useful treatment because it's going to, of course, prevent pregnancy. So we are having to find alternatives to decrease symptoms and improve fertility outcomes. But as far as younger women who are diagnosed with endometriosis in their late teens, I think that there are also better options than the pill because it's not really fixing the underlying cause of the illness. It's just masking the symptoms and maybe abating the symptoms for the time being. But if the woman goes off the pill, then those symptoms are likely to immediately return or shortly return.
Thank you. So right now we've talked about some of the symptoms and complications of endometriosis. So check our second video today to find out how Dr. Namas herself, takes care of people with this problem.